So you're looking to get a HoLEP done. You'd like to come to the United States to have this achieved. Where should you be looking? Where are the options for getting it done? Hi, I'm Dr. Austin Slade, a board certified and fellowship trained urologist specializing in the HoLEP procedure. Today, I'll be answering your questions on where in the US you might be able to travel for this surgery, where are the experts found, and how you might be able to identify them. I get a lot of inquiries from folks within and outside of the United States asking, where can I go? Where's the closest center near me to get this HoLEP surgery done? And this can be a challenging question to answer because though you may find someone who offers HoLEP, are they a high volume surgeon? We know that a lot of the important outcomes from this, such as leakage of urine, depends on the expertise and skill level of your surgeon, which in large part just comes with the volume at which they're performing the surgery. Ideally, you're having someone who's doing 10 to 20 of these a month where their skills are really honed and sharp and they're able to offer you the latest advancements in technique to give you the outcomes that you're looking for. So where might you find one of these experts? Well, we've helped to create a resource, enucleate.org. I'll put the link below. From this website, you can find this is a dedicated group of urologists across the country who have shared interest in providing excellent outcomes to our patients and are high volume HoLEP surgeons. We have a map there that you can look at and see where might be the closest center to you. And all of the surgeons on this site I would consider high volume. Now, this list is not all inclusive. There are other high volume surgeons within the United States and outside the United States that might be able to provide you excellent outcomes. So some of the things we mentioned before are going to be what you're on the lookout for, and may ask them, how many are you doing a month on average? Have you done at least a couple hundred? That's going to be a safe starting point. Within the United States, there are a few high volume or well-known centers of excellence. This surgery started at Indiana University back in the late 90s. That's where I performed my fellowship, worked with the originator of that surgery here in the US and several of his other trainees. So as this surgery started in the late 90s and urologists were starting to learn this at Indiana University and others who took it upon themselves to become self-taught, slowly and surely centers of excellence have popped up all over the United States. There are several centers all over the US that meet this high volume criteria. Some of the well-known ones include Indiana University, of course, Vanderbilt University. You have the Mayo Clinics. Each of their locations have qualifying surgeons. Scottsdale, Arizona, Rochester, Minnesota, and Jacksonville, Florida. Then there's Northwestern University in Chicago. And of course, myself in Boise, Idaho. When you're considering which location might be ideal for you to visit, might be helpful if you have direct flights or ease of travel. But another important consideration is cost. The cost for the surgery, the services, the workup, that cost may vary widely from one location to another. And I've been shocked to hear some of the differences in prices as patients have searched around for access to this procedure. If you're using an insurance plan to cover this, fortunately, those rates are somewhat fixed by the insurance, although different locations might have different rates contracted with your insurer. But if you're paying cash, be prepared to pay upwards of $40,000 or even more in US dollars for it. Fortunately, I've partnered here in Boise with a physician-owned hospital that keeps those administrative costs to a minimum. So while some sites might be charging upwards of $40,000 cash for this, you can expect around $10,000 all in. So we are proudly the highest value center of excellence within the United States. The most wild thing about the difference in the $10,000 versus $40,000 locations is where is that money going? You might think, gosh, I'd be willing to pay top dollar to get the top experience. Surprisingly, none of that is going to your surgeon. That extra $30,000 pure to the hospital administration. So make sure your money is spent wisely. Other things to consider when factoring in the travel for this would be the ease of travel to your location. If you're flying into some of these big destinations, it can be challenging to rent a car, or it could be a lengthy distance from the airport to your location. Fortunately, here in Boise, Idaho, my clinic's just 15 minutes away from the airport. There's on-site rental car services, Uber, Lyft, you name it. So it really makes the travel in and out experience very easy and manageable, in addition to already being a high-value center. Another factor to consider would be the waiting period between the consultation and getting your HoLEP surgery. I know in some parts of the world there can be wait times of 2, 3, or even more years where folks are stuck with a urinary catheter or their urinary symptoms waiting to have access to this procedure. Even many of the centers in the US might have wait lists of 3 to 6 months to get this done. Probably here in my clinic, especially if you have a urinary catheter, we could plan on getting your surgery done within 1 to 2 months and can concentrate and consolidate the number of visits required to make the best use of your time. Would you need a travel companion if coming in to get this surgery done? That varies from center to center. If this is an outpatient surgery done at a surgery center, then there is a requirement that you have somebody staying with you overnight with that surgery just to make sure that there's no complications from the anesthesia. Now, if you don't have anybody that can travel with you, then there are arrangements that can be made for that, whether that be spending the night at the hospital, watching you overnight and releasing you the next day, or pairing you with a nursing service that could accompany you for your first night stay in a hotel. So if you're looking at traveling for the HoLEP surgery, how long would you be expected to stick around town? I can certainly speak to my practice. In most instances, we would do a consultation visit and any remaining portion of the workup that hasn't already been completed on a Tuesday or Thursday. Those are days where I do my clinic. And then surgery would be the next day, whether that be a Wednesday or a Friday. I certainly like folks to plan to stick around for 2 days after their surgery. So if we did surgery on a Wednesday, you would have a complete full Thursday of recovery to make sure things are going well. And then if all continues to go well, you could safely return that next day, Friday, although each case is different, and there's always the potential that we might want you to stick around just a little bit longer depending on what you're experiencing. There's no rush to get back home though. There's lots to see in Idaho and other parts of the US. So if you wanted to extend your stay, you're going to be able to walk around. We limit heavy exercises, so don't plan a ski trip or mountain biking trip around your surgery, but you're certainly free to explore the city, go out to eat, walk around and see the sights. Every month, we welcome patients from all over the United States and outside the United States into my clinic. So if you have any questions about the details or making this work for you, please feel free to reach out and see how we might accommodate you best. I hope you found this helpful, and if I can be of help in your search for getting this surgery done in the US, please feel free to reach out and see what we can do to get you paired with a high volume and excellent HoLEP surgeon.